One of the biggest studies into the impacts of COVID has been released this morning. The UK research shows changes in the brain that affect memory and smell and increased cognitive decline. Basically, your brain shrinks a bit. That's my analysis of it, by the way, no one else's. Joining us for more now is Neuroscience Research Fellow, Dr. Indranil Basak, who has been doing a parallel study into this issue. He joins us now. Good morning.
Morning, how are you guys doing?
Good, thank you. Is that a fair assessment of it? It shrinks some people's brains?
Yes, from the study, it seems like there were 401 patients who were infected with the virus, and looking at the brain size at different regions or the sections of the brain, it looks like the volume has decreased significantly after the infection. And these all have been done by brain imaging. So yes, there is a decrease in size, as well as there is a decline of the cognition. Like for example, they did a test called a trail test, and they found like the participants or the patients who were infected by the virus, they were slower in their response, and that could mean that the virus can affect brain function as well.
Right, so they were a bit slower several months after. And I want to make clear, this is for those who were infected, had a mild case of COVID-19. Yeah. It's not for those who had severe problems. So this is for people who got off pretty lightly in the early stages. And there were about 785 who they were studying. Do you know what percentage of those people ended up with this shrunken brain?
I think what I learned from the study was like there were 401 patients and 384 healthy controls. And I think most of them had this brain shrinkage, and they compared their data with people who were hospitalized as well. I think there were 15 people that were hospitalized. And the effect in the hospitalized people were also more as compared to the healthy controls. So I would say it's not in everyone, but it can cause a significant change in most of the affected people.
When you say significant, what do you mean by that?
So basically the difference is consistent and across different patients, or if you take them collectively. Now, if you look at the data, you will probably see like data points that are individuals who were affected, but their increase or decrease in brain size was not as much as other people. So there is always like variability among humans. But collectively, when I see at the data, most of the people trend towards, or most of the patients who are affected by the virus are actually trending towards a shrinkage of the brain and decrease in the function.
By how much does the brain shrink?
I think it was around like 6%, more than 6%, if I'm not wrong.
Okay. That sounds like a few big nights out, doesn't it?
Yes.
Goodness me. So in terms of how, because the other thing about this study is it's looked at people over the age of 50, right? They haven't looked at younger people. Is that significant?
So we need to take into consideration that there are changes in the brain above 50, like we age, of course. But yeah, we need more data, more studies looking at people who are aged below 51, because the recent data have shown like a lot of, especially with the Omicron, a lot of the young people are getting this virus. So yeah, that's something that needs to be tested actually.
And can we separate the effects of the last few years, you know, the lack of socialisation, the staying indoors, you know, can we separate that stuff from the infection itself?
That's a great question. I would say there has been studies, like there are several, multiple, I would say, long COVID studies going across different places on this planet. And what researchers are looking at is basically what's the overall effect of COVID, whether if it's through the virus or if it's through the isolation and the lockdown and isolation from people and work and schools. So we still don't know the answer, but there is definitely going to be some effect on the brain, whether that leads to the shrinkage of the brain or whether it's the virus which is causing some damage to the brain, or is it like an indirect effect of the virus on our body? through the immune system, we still don't know what is actually causing these changes.
Okay, so jury's out. We need a bit more information, basically, before we can make a definitive assessment.